Morning. It is 9:58 and we'll get started in just a couple of minutes. Well, thank you all for joining us this morning for our October Community Cafe. We appreciate seeing new faces, and a big thanks to everyone that joins us each month. Our community cafe planning team is going to be going through some changes because this is Robert and I's last community cafe as we transition out of partners. But we are so happy to have been able to facilitate these community cafes and have these conversations with you all around the different topics throughout the year. So it is a bittersweet event for me this morning because I have enjoyed and appreciated all of the attendance and the conversation, the connections that have been made through these cafes, and the whole team really appreciates your attendance and participation. So this month we are going to be talking about it's Disability Employment Awareness Month, and we're going to be talking about transitions to independent living. So we do have closed captioning that's auto-generated by Zoom. You have the option to turn that on or off. I'm Katie. I'm one of the regional directors over Burke, Catawba, and Rutherford. And my coworker and colleague, Robert, will be monitoring the chat. So if you have any questions, you can just pop them in the chat. If you guys want to chat with each other, share any links, feel free to do so. And Robert will be overseeing that. And we have a great lineup of panelists today for you. We are going to actually start off with some information about a housing event from Erin. So Erin, you want to give your update?
Yes, absolutely. So hi, everyone. My name is Erin Gaskin. I am a housing specialist here at Partners. I primarily work in Cabarrus Union and Stanley County. However, we do have an upcoming event that is available for everyone in all of our 14 counties. So this is a resources for landlords event. Property managers are also welcome as well, or anyone that just wants some information kind of about some of our housing programs, things like that. So the event is Wednesday, November 9th, coming up pretty soon. It's going to be from 11 a.m. to 1 p.m. And I can get you registered. So let me tell you a little bit more about the event. So in our event, you're going to learn how to get your organization, your homes that you own and are landlord for on our key housing list. We're also going to tell you about the networks that we have in place to make sure renters pay on time. Additionally, we're going to give you some information about services that we wrap around our members to make sure that they are the best possible tenants you can have. So we definitely want you a part of this event. If you're not a landlord or property manager, maybe you have a friend who is, and you're welcome to give them my information as well. Another awesome thing that we have going on with this event is that we're partnering with the Fair Housing Project, which is part of Legal Aid of North Carolina. And so they're going to give us a training on landlord rights and responsibilities under the Fair Housing Act. And for everyone that attends and wants a certificate of attendance, you definitely can get that from the Legal Aid Fair Housing Project. And so you can kind of like check that off your to-do list. So we're excited to have everyone. This is going to be an awesome event, a lot of good networking. I hope you will come. I'm going to put my email address in the chat box. And so if you're interested, give me an email. We'll get you registered, and excited to see everyone there. Thank you.
Thank you, Erin. And I believe that our Abby with our marketing and communications team will send that information out to everyone in attendance as well.
Perfect. Thank you.
So up next, we have Jamie Brown from Sipes Orchard Home. Jamie, you want to take it away?
Sure thing. Hi, everybody. I'm also on the line with Amanda Smith. She's a program supervisor of our Young Adults in Transition program. And I'll explain what that great an acronym means in a little bit. SIPES is in Conover. It is the area's old orphanage. When I hear SIPES referred to, it's the old homeboys. Not in the slang way we use it now, but that's what they were called in the 30s, 40s, 50s. We've evolved through the years, and right now, primarily focus on transitional living for youth. Because if you call them kids, they get upset, and I just don't like clients. Our youth are ages 16 to 21 here on our campus, and 16 to 24 in the community. And I'll explain those two services to you. What is our transitional living program? We're working on, for any of you that have sort of gotten through raising teenagers, we're working on all those young adult issues. With some of our youth this morning are at high school, primarily juniors and seniors. Some of them are asleep because they're out of high school, and they might be going to work at 3, 4 o'clock today. So it's unlike a group home where everybody's on the same schedule all the time. Transitional living programs, they're kind of on their own schedules. We have some that are working part-time and at CVCC, but everybody's doing some combination of school or education. We do all the normal life skills things here, as far as learning how to do your own laundry, hopefully learning how to cook beyond turning on a microwave, learning how to drive, which I think is critical, because unless we're all moving to an urban center, you can't get around public transportation where our kids need to go for their appointments, and they don't typically work traditional Monday through Friday 9 to 5 hours. We are about to open a house across the street that we held open for to quarantine any youth that have COVID. So we have a guy's cottage, a girl's cottage, and now we're about to open a small house across the street to give us a few extra beds, and that's going to be for youth that are doing well in one of our cottages, so that they can have some more freedom, have some more independence. The running line here is we want you to have freedom. We want you to date. We want you to do all those young adult things. You will have as much freedom as you show that you can handle. We say yes a whole lot if you're taking care of the things that you need to. We say no, but we try to put more and more of the control and choice in their hands, which I think is key for this age group kind of muddling their way into young adulthood. So we have services here on our campus, and we also have services in the community. That's what we're contracted for with the MCOs. That's the Young Adult in Transition program. Now, some of those youth might start here, but then Amanda and her staff work with them. Oftentimes what we use the service for is somebody in their last few months here and now to go out there. For years, we talked about aftercare. And if any of you worked in residential programs before, aftercare was just kind of something we said, but really you heard from kids anecdotally, and they might reach out to you when they're in a crisis, but there wasn't true aftercare. The services allowed us to continue to work with kids, because what we've often found is when they leave here, and I know this is going to be shocking, but kids still need a support system at 19, 20, 21 years old, even when they leave a place like this. Kids from normal backgrounds, which our youth aren't, often aren't fully independent until 25, 26 years old is what the data tells us. So I don't know why we expect the youth that are the least prepared, youth from trauma in their background, family addiction, those kind of things, to be the most prepared at the youngest age. But that's how the system works. Amanda, talk about some of the things you do with our youth in the community when they leave here, and they're often, here is kind of practice ground, but they have a safety net here. And when they go out there, they're largely on their own without a support system. So what are some of the things that you guys focus on there?
Well, one is helping them to connect to others to learn how to create their own healthy support system, because it's very important. And also taking the skills that they learned on campus to help them to learn to maintain stable housing. Finances is a very big thing that we have to work on, making sure, because, you know, it's very hard to budget when you have limited income. So a lot of the times, knowing that there's not a lot of affordable housing, we do work with them to find roommates so they can share the cost of those things. Making sure that they are staying connected to their mental and physical health providers. And just kind of just like monitoring them for like that first year to ensure that they know how to, if need be, how do they contact DSS if they're needing to apply for, say, food stamps, or if they need to renew their Medicaid. And how do we, you know, we negotiate a lot with helping them learn to communicate with their property managers.
I'd like to talk about a little bit, because I get a lot of calls about the kind of kids that often come here. Because sadly, this is a very underserved population. So I get a whole lot of referrals. The youth we serve most often are couch surfing, falling into some kind of homelessness, already on their own. Youth homelessness often does not appear like adult homelessness. You don't often find them in shelters and on the street. Like I said, a lot of times they're couch surfing and bouncing from one place to the next, often in, you know, not safe or supportive environments, to say the least. Youth that are in foster care, this is often a step down for them if you haven't been, if your family hasn't gotten better, and if you haven't been adopted by the time you're 16, 17, sadly, that's probably not going to happen. And these are going to be the kids that age out. Youth stepping down from a lower level or a higher level of care. Youth has been in a level 3 group home or a level 2 group home and done well there, and they're older, and now we think they're ready for, you know, the next transition, a little bit more freedom, some more responsibility, those kind of things. Youth I often get calls about that we tend to probably not take, or say they need to be stable in a more in a different setting here till we know they're ready. Don't often take youth from YDC or PRTFs. We've tried it in the past. It's just proven to be too big a jump to go from such a highly structured setting into our setting. Autistic youth have to be on the very high end of the spectrum. Again, it's just because we're not a group home that operates on an 8, 9, 10, 11 o'clock kind of schedule. You know, tends to be more what they need as far as structure go. And I get a lot of calls from parents that sadly have a out of control or failure to launch kind of teen that have a support system. And I try to give them resources, but I also let them know our program is more for kids that don't have a support system, rather than kids that have a support system and are simply choosing not to utilize it. So that's kind of the most common referrals and less common referrals that we get into. Would like to note there's probably only, and maybe there's more, but 5, 6 transitional living programs that I'm aware of in the state. Most only take DSS referrals. We take DSS, and we have a couple spots for Medicaid funded youth, and 1 or 2 occasionally for unfunded. Obviously, the unfunded spots, the waiting list is usually fairly long. And the community-based. I'm aware of one other organization that does the community-based kind of work. I'm not aware of anybody else that does both. So I think we have something unique here, something that hopefully serves this population very well. Amanda touched on the greatest challenge for us right now as far as affordable housing goes. And this is an issue across all populations. It's not just for young people. It's working, you know, lower income, unemployed veterans, you name it. So it was tough before COVID. And I'm sure, again, probably not a surprise, no landlord's heart jumps for joy when an 18, 19-year-old comes through the door and wants to rent off of them. So it can be a pretty big challenge for us and often takes several months. We work with the Western Piedmont Council of Governments. We try to work with the folks in the housing world as best we can. But like I said, it takes several months for us to find a place that's something they can afford and safe. There's plenty of places out there that you plop them in a trailer park somewhere, but not necessarily where you might want them to be living and residing. So that's probably the biggest challenge we're facing right now. I think it's going to take a collaborative approach. One of the things I'm looking for. So if anybody out there is working on the housing issue, is we have a large interest in looking for studios or boarding house kind of situation where we're willing to get some grant dollars, even own if we have to, or rent some rooms there. I had a realtor call me that I floated this out to a couple months ago and say, I found two 3-bedroom houses. And I said, no, that's not what I'm looking for. If I give them a 2-bedroom house at a reasonable rent, they're going to stay forever. They're going to be in their 40s when they move out. We're looking for starter kind of places to help them make that next step. I will put my name and contact information on the chat because I was not prepared enough to get some slides and some information to the group. So if anybody has questions that we don't get to today, feel free to reach out to me.
Jamie, I do have a question and a comment. So one of the really cool things about SIPES is that it's completely grassroots. Like, you guys started this as like a collaboration in the community. Can you talk a little bit about the inception of the program?
Yeah, a little bit. Let me see. Well, we're almost 80 years old, so I don't think you want me to go back that far. I know we have a few extra minutes to kill, but that would probably be all of it. But as far as the program is here, and one of the things that still gets my blood pumping every morning after doing this for almost a decade is it's such a needed service. I probably, like a lot of you, I worked with a lot of different services, foster care, group homes, those kind of things. And I hope those services were quality ones. But I also knew, if I woke up one day and decided to exit a foster care program at my last job, there are 4 or 5 other providers that would have been more than happy to jump in and gobble up my foster families and those kind of things. Whereas this service is very needed. So we're here. The campus-based program started because of outcry for it. These kids aging out, we're not doing much of anything for them. Boy, probably 9, 10, 11 years ago. And with partners, our community-based component that allows us to do aftercare, work with kids in the community, only started a little bit before COVID. And for those of you that had the experience of trying to start something new during COVID, that was great. But it was really through partners came out, looked at the place, saw our program and said, this is an underserved population. We want to do something here. Would you get in our network? To which I said, no, I won't, because you don't have a service for this. And why would I go to all the trouble of getting in your network if there's no service for this? And it took a year. And I give them a lot of credit because they said, okay, we need to write a service definition. All we need to do is write a service definition, run it through the chains here, run it through the chains at federal Medicaid, get it to be accepted, and then implement this. And honestly, I was a little skeptical for the first couple months, thinking, oh, sure, that's all we need to do. And it took about a year, and the folks at Partners and I kept sitting down saying, what do these kids need? Revising the definition to get it past the next hurdle and the next hurdle and the next hurdle. And eventually got, the powers that be in federal Medicaid to accept it. So because it is relatively new, and I know there's in different MCOs, there's different kind of services for this called different things. Well, for one, ours is better because we took all those existing service definitions and pulled the best from all of them. At least I like to think we did. But it really was kind of just a couple folks sitting around a table saying, what does this population need? We're not doing enough for them, those kind of things. And like I said, probably started a couple months before COVID did. So because you couldn't really do a lot of outreach and getting out to folks and having the meetings, those kind of things, there hasn't been a whole lot of outreach for it. So, hopefully as we all climb out of into the post-COVID world, we can do a bit more to promote this service. Man and I have talked about, yes, we're using the service real good for aftercare right now, but we think we have the back end issues figured out for our kids on campus here. But what we'd like to start doing is start using it on the front end. If you have a kid that's in foster care and maybe not ready for our campus yet, or just out there receiving some kind of mental health services, but they're not couch surfing, they don't need that housing component just yet. Let's start working with them early to get them ready to come to a place like this to be successful. So I think we have the back end of the service figured out. I think there's a lot of room for improvement on the front end.
Do any of our audience members have any questions for Jamie or Amanda? Just so you both know, I have a lot more questions, but I'll hold it. I just think it's just such a neat program, and you're right that it is very few and far between to be able to find the services like you guys offer. So kudos to you both.
Thank you very much. And like I said, I'll put my information in the chat when we're finished.
Thank you. Up next, we have Jennifer Wall with Cleveland County Schools.
So can I share my screen? Haley Blanton is with me. So we prepared just a really short PowerPoint. Is it okay if I share my screen?
Yeah, I think you should be able to.
All right, let's test it out. Oh, that's not what I'm trying to do.
You are
Slide
screen
share.
sharing.
There we go.
Yeah.
So you guys can see that, right?
Yep.
Okay, perfect. So I'm Jennifer Wall and Haley Blanton is with me, and we are from Cleveland County Schools. Our specific roles with Cleveland County Schools, we have a pre-employment transition services contract with vocational rehabilitation. That is unique to Cleveland County Schools because typically other service providers have those contracts. I think we are one of two in the state of North Carolina that facilitate the contract within the school system. There are other I know that you guys serve other counties, and so Gaston County, and there may be someone on here from ECAC, but Gaston County was funded their pre-employment transition services contract through their parent center, which is going to be a really cool way to see how that is facilitated. If you don't know about these contracts, we could give you more information about that, but we're trying to be mindful of our 10 minutes. So we will talk about our school level team planning. It's a multi-level approach to transition planning for students with disabilities. And so we are school level employees, even though we are facilitating the pre-employment transition services grant. We do serve transition at all levels through the school system. So our titles are we coordinate this program, but we also facilitate all things transition. One thing that we do called the community level team, school level team, and IEP team. One thing that Cleveland County Schools does that I think is unique is that we have school level team meetings every single month, and Partners is a part of our school level team. We appreciate Lindsay so very much. We saw her last week at one of our school level team meetings. What we do at the school level team is that one particular high school invites their juniors and seniors, sometimes primarily it's the juniors, and we invite all agencies, service providers, school personnel, students, and parents just of that particular school to one location. The student presents on themselves and what they have goals that they want to do. And then we discuss which of the agencies are able to help the students meet those specific goals, and that coordinates the teacher to be able to contact them for IEP development, for service providing, and things of that nature. And this is the IDA requirement that I'm sure all of us know. And inviting those agencies to the IEP meeting, we decided that this was it was part of an interagency push a few years ago. And so we decided that we were trying to get it back this year. Through COVID, we did it virtually, just like we're doing now. And actually, we did have 100% parent participation. through a lot of the school level team meetings when we met virtually, but we have found that, we're back in person now. Last week was our first one. We did meet on the college campus. The agencies came and, met with the students and things like that. So that's basically what that requirement is. And the data, I'm sure that a lot of you have seen this study, but this was done, Dr. Martin from Oklahoma University and the Zara Center did this a while back, but they did momentary time sampling data of who talks the most at IEP meetings. And none of us are surprised by the data that's on the screen that the IEP teacher is the one that talks the most at the IEP team. And in Cleveland County Schools, we want to empower the student to be the one who is discussing all things at the transition level. And Haley, who is here with me, she serves as our instructional specialist through the grant and all things transition, but she was, just a few years ago, an OCS teacher. And so, she was going to talk just a second about like what the teacher has to do to, get the student involved in these school level teams, because it's not as easy as, putting together a PowerPoint.
Right. So the students, we typically do, like she mentioned, a PowerPoint. We work together and have them, and it's all about them. And so they put everything from what their IEP goals are to where their goals are when they transition out of high school, work, independent living, and their education. And then we also really, some teachers are still trying to get on board with them facilitating their IEP. When I was in the classroom, really push the students to go over their transition plan, what their goals are. And a lot of times we have parents say, well, my child's going to do this, or I want my child to do that. But at the end of the day, it's what that individualized student, what their goals are. And so we try to work together as a team. And it's so great because then they come in and they present themselves to our agencies that we have that come to the SLT meetings, what that they need. So it's more focused on them versus what the agencies have. And so then the agencies can say, okay, well, I can help you in this area of your need. What's the next slide? Yep. And so this is just kind of an example that just looking at all the different needs, whether you can see the need physically or not, there are always a need that you may not be able to see that the students can present at the school level team meetings.
And one of the cool things that they've added to the presentations is the data that comes from transition assessment. So our staff are doing those assessments and the students actually go over, what the assessments show that they may be interested in or their abilities may be, and do they agree with that data and why? And then the second to last slide that the students go over is, how can you help me? And then they tell everyone in the room, here's the things that I need help with. And it could be something as simple as, I want to take driver's ed, to I want to live on my own. I want to go to community college. I want to do a certificate-based class. And so, all of our agencies that are in the room are then able to think or share the resources that their agency has to help them make that next step. And the parents are at these meetings too. So then it's a great connection.
And also, she just triggered something else. One of the slides that they present too are their barriers. What barrier do I have? And so that's how it really triggers on how the agencies in the community can help the students. They may want their permit or sign up for driver's ed, but the barrier is I can't read. Or I struggle with what roadsides, so anything with what the barrier may be, so then we can support them in overcoming that to meet their goal.
And it's not a PowerPoint that the teacher does with the student 2 days before the meeting. It's something that's ongoing within their classes. It's really based on data and it's real. It's not what the student may just think on that specific Wednesday is their barrier or their strength. It's based on the data the teacher has collected throughout the ongoing process. And therefore it's, it's real. And so the parent, the student, and the teacher have to have conversations, and they have to practice, because it's not easy for the students to talk about their disability or the barriers that they face in the community. And so, they practice with their classmates, they practice with their other, teachers, and they get feedback. And so it's a very good process for the agency to see, but it's also good for the classroom teacher to be able to work with the student on those skills all the way around.
And we also start the introduction of different agencies their sophomore year. So you see that they are their sophomore year. The agencies come in and present themselves. This is what I can offer. And then come there, like she said, the junior and senior year, the student presents themselves of what they need. So we start the process with the parents. The parents are invited to the sophomore meeting as well. And so we start introducing some of these agencies and resources that are out there that they may need. Come their junior and senior year is when parents really start, oh my goodness, what's next? 8th to 9th grade, no major worries, but you start getting those phone calls. Those parents are really worrying on what's next for my child, what's out there, what can I do to support them, what do they need? So I think this is a really great tool that Cleveland County started years ago. As long as I was in the classroom, SLT was a part of the process here. And it's just a great way just to give parents some ease of, hey, this is out there for you.
And we have the undivided attention of the agency, and that's what we believe is a benefit for our kids, is literally while we were sitting there, we can look up to see if the kid's on the registry, or we can look up and see if the kid's on a waiver, or if the kid has VR services, et cetera. And so then immediately we know if that's a need, what the teacher needs to do. And the benefit for Cleveland County Schools is Haley and I, that's our job. Our job is to make sure that these things are facilitated, and it takes the load off of the teacher because our teachers have so much going on already, and we're able to say, okay, here's the paperwork. What can we do to help? We can help with those follow-ups. And so these monthly meetings that we do by school, and like in 2 weeks, we have our sophomore meeting. So every sophomore in the county will come to one location. And this year we're doing it kind of like a transition fair where, you're able to go table to table and get information and things like that. So we're back to normal. So I think we've covered everything. Transition and our in our time allotted. Was there any questions or anything that we didn't cover? We tried to get it as much as possible. Literally, we could talk about this all day long. So
Haley and Jennifer, are you guys seeing any trends in treatment gaps or trends in things that students are experiencing as barriers?
oh shoot, I didn't mean to I hit the wrong one, didn't I? Stop share, there we go. So basically, I guess it depends because, our high schools are pretty spread out throughout the county. So
Every school's different.
every school is very different in transportation is always a need for a lot of our families. And so that's something that, we do invite public transportation to our meetings and things like that. But
I'll say which leads into them gaining employment. Parents have major issues with their child gaining employment because they do not want to lose their resource, their SSI, any support that they may get, because say this child, yes, very employable, they can work. Starting off with supportive employment with like a career coach is a major need with some of our population. But getting through with the parents to allow them to get to that point and then needing that transportation to get there, that student may do great, but they may have a breakdown in 2 months and they lose their job. And then parents are scared, how am I going to support them? Because now I've lost my SSI because they started employment. So really them gaining the true accurate information of, hey, my child can still work and I also still have this support in case something does happen, with their student one day,
And I think that's a pattern of behavior, like years and years of behavior,
Mhm.
where, people are worried about losing that, SSI and support Medicaid and things like that. And a lot of the information that's been given over time is not accurate. And so like as the school system, we are not allowed to, we inform parents and we give, students as much information as we possibly can, but ultimately we can't, facilitate decision-making, help with any of those. We just help them transition to the next step, but we desperately want them to get jobs and opportunities. But, you know, if $7 comes out of their monthly check because the kids made too much, I mean, some families, that $7 means that's a big deal. I mean,
But then
like,
they don't understand, well, that check they made was 207, so you
Yeah.
really made 200 extra dollars, you just lost 7 off of SS, excuse me, off of SSI, but it's so hard for them to wrap their mind around. They're really benefiting their child to have a purpose in the community by holding them back because they may lose a couple dollars off of SSI.
and we have a group of students that will forever work under the table for that exact reason. And we have students that, you know, those are barriers and they know what those barriers are. But we do have students that, you know, we work through it, and we have some great certificate-based programs at the community college. We have a great relationship with workforce development. Through our specific program, students do 4 work-based learning. 2 of the work-based learning, they are not paid. 2, they are paid. So they are building their resumes to get to the next step. So, I mean, our goal is post-secondary. So whatever they do, it could be education, training, employment, but that's the goal of our grant. But, you know, that is, I would say, definitely a top barrier is, you know, communicating that the student can work and still not lose the services that their family rely on.
Well, thank you both so much. Do we have any questions from our audience members for Jennifer or Haley? And feel free to pop any questions you have in the chat also.
I have a
And-
question. How often do you see the primary care physicians participating in your IEP meetings? Do you see that often or at all?
And occasionally when there's like a behavior, when
Well,
we see
we-
behaviors with medication and things, but
And we
I've been in the
typically-
classroom for 16 years and then this job going on 3, and I've never once had a primary care provider in one of my IEP meetings.
And one thing that we do have, though, is we have school nurses that get all of the release information to speak to the doctors and get information. And those school nurses come to IEP meetings frequently as needed, especially like some of the schools that have the most need. North Shelby School is one of the ones here in Cleveland County that the nurse is at every IEP meeting, because there could be, you know, very specific things that relate to the safety plan, the food plan, you know, all of those type things. So as far as actually having someone from the actual, I mean, not in the 5 years that I've been here at all, not once. But that data would be used through our nurse, I guess, to inform IEP type things, but actually attending the meeting, no.
Very interesting observation. Any other questions for Jennifer or Haley?
And we work closely with Lindsay from Partners, and we appreciate all that she does. We loved Shirley, and we know Shirley retired, and Lindsay has done, we got to meet her face to face last week, and we appreciate all that she does for our students. It's an amazing resource that we've tapped into just in, you know, the last couple of years since we've been in this role. So we appreciate all she does for our students.
Well, thank you guys also. Thank you for the presentation and the information. It's wonderful the program that you've built around getting these kids connected or youth connected to services and ready to transition into independence. So thank you.
And the question that I had is, the other presenters from today's time together, will we be able to get their information in case that because I was listening to Mr. Brown's presentation, and I was wondering how, and I don't know if this is applicable, but like our students here in Cleveland County or any of these other resources useful for our students and our purposes? And I can look them up, obviously, but I didn't know if your other presenters, if it was a resource that our students could use or if it's younger groups.
Jamie or Amanda, Do you guys want to answer that?
Yeah, our young adult and transition service is for youth that have a mental health diagnosis because it is a Medicaid service for youth that come to our campus. They often come through DSS, and obviously, it's a few counties away. I have had referrals from Cleveland County before. It's usually if they're ending up in this area because
We didn't know where you were located. We
Yeah,
logged on just a couple of minutes
Cava.
late.
we're in Conover, which is basically a suburb of Hickory.
Yeah, oh yeah, okay.
Well, thank you again. And up next, we have Mike Wall from Vocational Rehab. You want to take it away, Mike?
Sure, thank you. Hello, everyone. Thank you for coming to the Community Cafe today. I've been loving coming to these meetings and seeing people from other areas. I do work with vocational rehabilitation. I've been with them for 15 years, and I've been a licensed clinician for over 25. So I'm fairly well versed with how we serve as a funding provider and a service provider combo. And so we have a lot of services where we are case managing the effectiveness of the dollars that come down the federal pipe. The reason we're having the cafe today is for the National Disabilities Employment Awareness Month. And I'd have just a very few points to make about that, and then I'll entertain your questions. And I've got three important links that I'll copy into the chat. The first is NDEAM, National Disabilities Employment Month, Awareness Month, is a very long tradition. It started in 1945 by President Truman. And at that time, we didn't have any way to coordinate and pull together not just funding, but awareness of the need for these services to be able to connect the dots between culturally isolated children and youth transitioning with disabling conditions, and even without disabling conditions, into the world of work. You were either already a worker as a child labor person, or you were completely removed from and detached from the world of work outside of your own homestead. And so, when President Truman came along to kind of connect us all together and remove some of the silos and force us to work together for the good of the group, we began to transform, and we've come a long way, but we still got a long way to go. So the next point I would make is that it's been 45 years since then, and actually it's been more than 45, but 45 years later in 1990, we actually had the ADA pass that removed the barriers for us to be able to apply common language to be able to get more people at the table to understand how to multitask and reach out and advocate and not just give up because of a particular barrier, but to address barriers in a more transparent way so that we're taking advantage of group knowledge and group experience to help even the most remotely deprived, culturally deprived citizen. So as a result of that passage of the ADA in 1990, we actually ended up having 180 different countries around the world begin their initiatives to do the same thing. And so this has been a growing phenomenon in the world of career and education development that's been spearheaded by the United States. So then last year in 2021, Biden passed an executive order that actually required that we begin to apply diversity and equity and inclusion and accessibility front and center across all federal programs, especially when it comes to federal hiring. And as a result of that, we've taken a huge leap just this past year towards being able to put our mouths where our words are and try to bring boots to pavement to make this happen. Then, of course, that same year, right behind that, in North Carolina, our governor passed the executive order for the employment first for North Carolina. And so it's trickled down to the state level where we are expected to be able to utilize all these resources together. So the pre-employment transition services that was created and designed through the Division of Vocational Rehabilitation has been funded statewide. We do have some remarkable pilot projects where it's actually done within and contained within the school system. And one of those important ones is actually here locally for Surrey, Stokes, and Yadkin County. I work with vocational rehabilitation for Surrey, Stokes, and Yadkin County adults, and my co-workers cover Surrey, Yadkin, and Stokes schools for that transition piece. And so we're bringing that money directly in, and we have a cooperative agreement with Watauga Watauga Opportunities Innovations Plan. They actually come with us and case manage with us to serve our students to make that transition and have that funding for that initiative just described. The theme, every year for NDEAM, we have a theme, and this year the theme is disability, part of the equity equation. And my background is the poster for that for this year. And we do things like Disability Mentoring Day. That is traditionally the third Wednesday of every October, but it can be any day throughout the year. And what they do is we help employers to we give them guidance and ideas about how to promote an advocacy day to support the hiring of disabilities. Many of you may have heard before, we have a federal contract where if an employer receives federal funding, they are required to demonstrate that they're hiring persons with disabling conditions to a certain degree. There's a ratio, it's like 5%, I think, within the ranks of their staffing. And so promoting that and making sure that that happens is one of the background functions of this whole NDEAM initiative. I'm going to copy and paste a link in the chat for the mentoring day. The link is a list of ideas to help employers figure out how to design and implement and facilitate a mentoring day for hiring persons with disabling conditions. So that's the first important link. These year-round ideas, not just for National Disabilities Employment Awareness Month, but year-round, are highly supported throughout the federal system. Federally, it's under the Department of Education. The Rehabilitation Services Administration is under the Federal Department of Education. And here in North Carolina, vocational rehabilitation is 80% federally funded. So we have to really draw down those dollars. We have to spend our 20 cents of every dollar to get that 80 cents of every dollar to implement this. And so one of the ways that we help employers with mentoring and adding this to their milieu of outreach and staff retention and staff recruiting is through these mentoring days. So this next link is a list of ideas for promoting and having an event anytime throughout the year. North Carolina Division of Vocational Rehabilitation covers all 100 counties, but we're federally based. And so we are not county by county, we are by federal unit. For example, I am in the Winston-Salem unit. And so under Winston-Salem, we cover 5 counties. And 3 of those counties, Surrey, Yadkin, Stokes, are my counties. And then the Lexington unit covers the Yadkinville students, the Yadkinville schools. And so there's an overlap between adults for Yadkin County and students for Yadkin County with 2 different vocational rehabilitation federal units. That doesn't really matter, but helping to understand that structure helps people to feel more empowered in reaching out and getting connected with voc rehab services, because we are very well funded to support the services required for comprehensive meeting of students in transition to adults trying to get and keep jobs. So the next link that I'm going to share is a important link because it will take you to the website, the state website for voc rehab at the Department of Health and Human Services, so that you can search and find the closest VR office to your location, so that even if the system doesn't seem to be working behind the scenes through the school system or through the employment office, the public employment office of the Department of Commerce, even if it doesn't seem like it's working at that level, it very well may be, and it very well may benefit from your advocacy for reaching out for the local offices. So that link is in the chat so that you can just look up your local office. Stokes, Yadkin is covered by Lexington and Winston units combined. Stokes and Surrey are all covered by the Mount Airy satellite office of the Winston unit. So we're all combined. Then we have a deaf and hard of hearing caseload that covers all 5 counties. And then our sister agency, Services for the Blind, and then the other deaf and hard of hearing services agency. We all 3 work together to make sure that the needs are met for people to address their impediments to employment in addition to their common barriers. So I'm going to post my contact information in the chat so that you can get a hold of that. And I'm also going to put the Yadkin County schools, since they are a little bit separate from us, we don't want them to fall through the cracks. We serve them both. If they have someone who is particularly severe with their impediments in terms of addiction or mental health issues, since I specialize in that, sometimes I do carry those caseloads, those cases for the 2 units just because of my specialization. But the way to get connected is through your high schools, and then of course through our local Mount Airy office for vocational rehabilitation. So that's about the gist of my points, and I'll entertain any questions you guys might have. By the way, in closing, the comment about SSI and SSDI, disability determination services at Social Security is a subcontract of vocational rehabilitation. We don't even have to have a release of information for that because it's under our program. And so we are funding and connected to all of the benefits counseling provisions for persons on those benefits.
Hi, Mike. Can you hear me?
Yes, ma'am.
Thank you for this presentation. I really appreciate the information you shared and the historical reference. I do have a question as it relates to members who are reluctant to admit or say that they have a disability,
Yes.
and how that kind of impedes us from fully servicing and meeting those needs. How are you confronting that?
Yes. It's multifaceted and complex. It's not just simple black and white, but one of the references is that for years, the recovering community for both mental health and addiction has used the saying, you know, you can lead a horse to water, but you can't make them drink, but you can hold them down there and let them watch everybody else drink till they get thirsty. So, you know, by whatever means necessary, if it's in their best interest, if we're all on the same page and it's not really, you know, whether you see it as manipulative or unethical or not, if a person needs assistance with informed choice, it's an innate right that we all have, the ability to be participating in the decision making. Nothing about us without us. And so that's one of the reasons the previous presentation said, you know, we want the students to speak up. We want to work with the students to practice. So when it comes time for them to self-advocate, they've been doing that for a while and it becomes more effective. So one of the hints that I give is, if you tell them, don't tell them they're coming to vocational rehabilitation or they're going to an employment office because of their disability. Tell them they're coming to the employment office to get information about what is available and what they can use to help them accomplish their dreams and their goals. And then when they get to us, we're actually very adept, and many of us are licensed clinicians in being able to protect that right to informed choice and give enough information that they're able to look at their own motivation and maybe move from that precognitive state and move towards, I really want to try to find out more information about this. And then if it's just seed planting for later, that's better than anything at all. So it's always an ongoing struggle. And so I'd usually try to tell people, we're just the confidential employment office. It's not the public employment office. It is the private employment office where we give you more one-on-one help to decide what is in your own best interest. What do you want to achieve and how can we support you to do that?
Awesome response. Thank you for that.
You're welcome.
Thank you so much, Mike. And I also appreciated the history lesson. Anne, you are up next to speak. We have a few minutes if you want to briefly touch on the registry, and we'll give your contact information if anybody has any follow-up questions on that.
Sure, I will make it very quick. Let me go. I do have a few slides. I'm going to share those just briefly. Gonna move through them quickly. So let me go ahead and do that. All right, so just super quick. When I talk about the Registry of Unmet Needs, I always want to make sure that people know there's more than one waiting list. So the Registry of Unmet Needs is a waiting list for the Innovations Waiver, and I'll tell you a little bit more about that in just a moment. There's also a state-funded waiting list. Many of you know, most of you know that there are state funds out there, that you also probably know that they're very limited. So typically what happens is a provider will make a referral or a request to tap into the funds or to put the individual on the the state funded waiting list. You can do that by going to Partners website. Robert's going to drop something in the chat for you to give you the link. It's right on the provider knowledge base. You're going to be able to access that form, and then there's also an email he's going to share with you if you have additional questions about state funded services and the waiting list. It's an array of services to include residential and others. So the Registry of Unmet Needs is waiting for the Innovations Waiver. Thought it would be important to know what you're waiting for to get on the Registry of Unmet Needs. So the Innovations Waiver is focused on individuals with intellectual and developmental disabilities. It's home and community-based services to support the individual to live in their own home in the community versus living in an institutional setting. So that's in a nutshell what the Innovations Waiver is. The Registry of Unmet Needs is managed within Partners within the IDD Care Management Department by the registry specialists. The wait lists are based on first come, first served, the original date that they're placed on the registry, no matter what county you live in North Carolina. There, it's managed by all of the appropriate MCOs that serve the county. So how do you get on the registry? You connect with Partners or your local MCO. So you can connect with Partners by calling our access line. You can also send an email to IDD Registry or call the registry line. There's two different numbers. Either number is fine. And again, Robert's going to drop that in the chat for you for easy access. The registry specialists are going to talk to the individuals. This is a brief map that is accessible on our website. I can also share this with Abby so she can get this out to you. It's a step-by-step that you can share with families and individuals so they know what to expect when they're going through the registry process. And then who's eligible for the registry? So you have to have an IDD diagnosis and a limitation of 3 out of the 6 areas of functional limitation that are all listed here. It's all really focused on self-care, activities of daily living, all of those things that we all do each day, you know, learning, mobility, self-direction. And so these services support the individual to be able to live as independently as possible in their home or out in the community. And this is some more information on the registry team contact. Christy Murphy is our IDD Care Connection Supervisor. And again, that's that same information I just gave you about the IDD registry contact. So, and then one final plug. I am part of the member engagement team here at Partners. And what we do in member engagement is to help families and individuals navigate our service system. So we're here to answer questions, to have conversations with members and families if you want to direct them to us. If it's really someone who needs their handheld, just has a lot of questions and doesn't quite understand things, we're here to help them connect and help them walk through our system. That's our phone number there right in the center of the screen, 704-884-2729 to get connected with us. You heard Jennifer Wall from the Cleveland County Schools talk about Lindsay. She's part of our team. And so we're super happy that she is able to be part of the Cleveland County Schools program. So be glad to entertain any questions, or y'all can reach out to me. So thanks very much for the opportunity.
Thank you, Anne, and that is perfect timing. So anybody that has any questions for Anne, I think we've shared her contact information in the chat, and feel free to reach out to any of us at Partners for more information. And I'm going to hand it over to LaQuisha to close us out.
Well, on behalf of Partners and Community Cafe, we would like to say thank you to all the panelists. And we also would like to thank you all for joining us, and we invite you back next month. Our topic will be Veterans Court. And we do hope you all have a great day. Thank you.
Thanks, everyone.